I'm Dr. Alan Mendel, and in the next 25 minutes, I want you to look at your own body in a way you probably never have before. What I'm about to show you are 15 hidden warning signs that your thyroid is quietly failing, and most people mistake every single one of them for stress. I've been a practicing physician for over 40 years, and these are the exact signs I look for in every single patient who walks into my office. The thyroid is one of the most overlooked organs in conventional medicine, and by the time most people get a diagnosis, they've been suffering silently for years, but it doesn't have to be that way for you. Your thyroid is a small butterfly-shaped gland that sits right here at the base of your neck, and it controls almost everything. It controls your metabolism, your energy levels, your body temperature, your heart rate, your digestion, your mood, your ability to think clearly. It is quite literally the master regulator of how your entire body functions. And when it starts to slow down or malfunction, it doesn't announce itself with flashing lights and sirens. It whispers. It gives you subtle signals that are easy to dismiss, easy to explain away, and easy to miss. And that is exactly why millions of people walk around feeling terrible all the time without ever knowing their thyroid is the culprit. Let me tell you something that might surprise you. According to the American Thyroid Association, an estimated 20 million Americans have some form of thyroid disease, and up to 60% of those people don't even know it. That's not a small number. That's a public health issue of enormous proportions. And the problem is that standard blood tests often miss thyroid dysfunction in its early stages. Your TSH might look normal, your doctor might tell you everything is fine, and yet you feel absolutely terrible. Why? Because conventional medicine often relies on a narrow reference range that doesn't capture the full picture of what's happening in your body. I'm going to change that for you today. What I want you to do right now is place your hand gently on the front of your neck, just below your Adam's apple. Feel that? That's approximately where your thyroid gland sits. Now I want you to pay very close attention as I walk through these 15 signs, because you may recognize several of them in yourself. And that recognition could quite literally save your life or dramatically improve the quality of your life. Stay with me all the way to the end, because sign number 7 is the one most people completely miss, and sign number 15 is something I see in my practice constantly, and it rarely gets discussed. Let me start by explaining what's actually happening when your thyroid begins to struggle. Think of your thyroid as the control center for your body's energy production system. It produces two primary hormones, T3 and T4, which travel through your bloodstream and tell every single cell in your body how fast to function. When your thyroid is working optimally, you have steady energy, stable mood, healthy digestion, normal body temperature, and a well-regulated metabolism. When it starts to underperform, everything slows down. Cells don't burn fuel efficiently, toxins build up, inflammation increases, and your whole system starts to compensate in ways that show up as symptoms throughout your body. This is why thyroid dysfunction affects everything from your skin, to your brain, to your heart, to your digestive system. It's not one organ misbehaving. It's your entire regulatory system starting to sputter. Now, I'm going to walk you through each of the 15 hidden signs. For some of these, I'm going to ask you to examine yourself right now. I want you to actually do it, because this is how you become aware of what's happening inside your own body. Sign number 1 is something almost every person with a struggling thyroid experiences, but they attribute it to everything else under the sun. You feel cold all the time, not just occasionally chilly, but genuinely cold when everyone around you is comfortable. Your hands and feet are ice blocks even in warm rooms. You need a sweater when others are in t-shirts. Your office might be 72 degrees and you're still shivering. This happens because your thyroid controls your body temperature, and when it slows down, your core temperature drops. Your body literally cannot generate enough heat to keep you comfortable. I see this in my practice constantly. Patients tell me they sleep with 3 blankets. They can't warm up no matter what they do, and they think something is just wrong with them. More often than not, their thyroid is the conversation we're not having. Sign number 2 is one of the most common complaints I hear, and it's almost universally misdiagnosed as stress or depression. You are exhausted all the time, but it's not just regular tiredness. It's a deep, bone-level fatigue that doesn't go away no matter how much you sleep. You wake up tired. You get through part of your day, and you're wiped out by 2 in the afternoon. You need naps. You can't get through your normal routine without feeling like you're dragging yourself through mud. This is not normal. This is your body telling you something is wrong. When your thyroid is underperforming, your cells don't produce energy efficiently, and you feel the effects systemically. The Cleveland Clinic has published research connecting chronic fatigue with thyroid dysfunction, and in my experience, when we address the thyroid, the fatigue often improves dramatically. Sign number 3 has to do with your weight, and I know this is a sensitive topic for many people, but it is critically important. You're gaining weight or struggling to lose weight despite eating well and exercising consistently. You cut calories, you run on the treadmill, you do everything right, and the scale just doesn't budge or actually goes up. This is one of the most frustrating experiences a person can have, and conventional doctors often dismiss it as a willpower problem or tell you to eat less and move more. But here's what's really happening. Your thyroid controls your metabolism. When it's sluggish, your body burns calories at a dramatically reduced rate. You could eat exactly the same as your thinner friend and your body will store more of it as fat. This is not your fault and it's not a character deficiency. It's a metabolic problem rooted in thyroid dysfunction. I want you to look at your midsection right now. If you've gained weight specifically around your abdomen and hips while your arms and legs remain relatively thin, that pattern is a classic sign of thyroid-related metabolic slowdown. Sign number 4 is something you can examine right now. Look at your skin. Is it dry, flaky, rough? Does it feel like sandpaper no matter how much moisturizer you use? When your thyroid is underperforming, your skin cell turnover slows down dramatically. New skin cells aren't being produced as quickly, and the old ones hang around longer, making your skin look dull, dry, and aged beyond your years. You might also notice your heels are cracked and your elbows are rough. I want you to run your finger along the back of your hand right now. Feel that texture? That dry, almost papery feeling is something I see in thyroid patients constantly. Your skin is one of the most revealing organs when it comes to internal health. It shows everything. Sign number 5 has to do with your hair and nails. Take a look at your eyebrows right now, specifically the outer third of your eyebrows. This is the area closest to your temples. If that part of your eyebrow is thin, sparse, or actually missing, that is one of the most reliable visual indicators of low thyroid function that exists. Your eyebrows thin from the outside in when your thyroid is struggling. I want you to hold up your hands and look at your nails. Are they brittle? Do they split or chip easily? Do you have ridges running lengthwise along them? Those ridges, that brittleness, the peeling and breaking, all point to thyroid dysfunction. Your hair is also going to tell you a story. If your hair is thinning, if it's dry and straw-like even after conditioning, if you're losing more hair in the shower than normal, if your eyebrows and eyelashes are sparse, those are all signals your thyroid is sending you. Sign number 6 is something most people never connect to their thyroid: constipation and digestive issues. If you're not having a bowel movement at least once a day, if you feel bloated all the time, if things are moving very slowly through your system, your thyroid may be the reason. Your thyroid affects the motility of your entire digestive tract. When it's sluggish, everything slows down, including the movement of food through your intestines. You might also notice that you have food intolerances you didn't have before, or that certain foods bother you now when they never did. I want you to pay attention to this because digestion is foundational to your overall health. If your body can't properly absorb and eliminate, everything else suffers. Sign number 7, and I told you this one was important, is mood and cognitive changes. Many people with thyroid dysfunction experience depression, anxiety, brain fog, and an inability to concentrate. You might feel like your brain is in a fog. You walk into a room and forget why you went there. You lose your keys constantly. You can't remember names you used to know. You feel a sense of impending doom or a general lack of joy in things you used to love. These are not just stress. These are neurological symptoms rooted in thyroid hormone deficiency. The thyroid hormones are critical for neurotransmitter production and brain function. When they're low, your brain chemistry changes. This is one of the most misdiagnoses in medicine today. Patients get prescribed antidepressants when what they really need is thyroid support. Sign number 8 is for the women watching. If your menstrual cycle has changed, if it's become heavier, more prolonged, more frequent, or if you've noticed significant irregularity, your thyroid could be the cause. The thyroid directly affects your reproductive hormones, and when it's malfunctioning, your entire menstrual cycle can become disrupted. Many women I see with thyroid issues describe cycles that went from normal to suddenly problematic over the course of several months or years. They've been told it's perimenopause, stress, or just part of getting older. And while those can be factors, the thyroid should always be checked. In fact, the American Thyroid Association specifically notes that thyroid disorders are more common in women than men, and menstrual irregularities are a key indicator. Sign number 9 is something your doctor might have mentioned to you already but probably didn't connect to your thyroid. Your cholesterol is elevated. You might be on a statin medication right now for high cholesterol, and nobody has ever talked to you about your thyroid. But here's the connection. Your thyroid hormones play a major role in how your liver processes and clears cholesterol from your bloodstream. When your thyroid is slow, your liver doesn't clear cholesterol efficiently, and levels go up even if you're eating well and exercising. Research published in the journal Thyroid and supported by the National Institutes of Health has confirmed the direct link between hypothyroidism and elevated LDL cholesterol. This is not a coincidence. If you have high cholesterol and you're struggling to manage it despite diet and medication, you need to ask your doctor about your thyroid. Sign number 10 has to do with your heart. Pay attention to this one. Do you feel your heart racing sometimes when you're just sitting quietly? Do you notice your heart is beating irregularly or fluttering? Are you aware of your heartbeat more than you used to be? This is called heart palpitations, and it is a very common symptom of thyroid dysfunction. When your thyroid overproduces hormones, which can happen as well, or when it fluctuates, it directly affects your heart rate and rhythm. You might also notice that your resting pulse is higher than it used to be, even though you're not doing anything strenuous. I want you to put 2 fingers on your wrist right now and count your pulse for 60 seconds. Write that number down. If it's consistently above 85 beats per minute at rest, that is worth investigating further with your thyroid in mind. Sign number 11 is muscle and joint problems. You're achy, your joints hurt, your muscles feel weak. You might be attributing this to aging or overexercise, but if it's persistent and doesn't match your activity level, your thyroid is a suspect. Hypothyroidism causes muscle weakness, joint pain, and stiffness, especially in your hands and feet. You might also notice carpal tunnel syndrome symptoms, tingling in your hands, or a general feeling of heaviness in your limbs. These are not things you should just accept as normal aging. Your body is telling you something. Sign number 12 is something many people experience in silence: hoarseness and voice changes. If your voice has become deeper, rougher, or you feel like you constantly have a frog in your throat, that can be a sign of thyroid enlargement or inflammation. Your thyroid sits right next to your voice box, and when it's swollen or compromised, it affects your vocal cords. You might also notice that you frequently lose your voice, or that your voice gets tired after talking for just a short while. I want you to hum right now. Just hum a simple note. Does it feel strained? Does it feel like your voice is deeper than it used to be? These are things worth paying attention to. Sign number 13 is one of the most insidious signs and one that gets dismissed constantly by both patients and doctors: sensitivity to medications. If you find that you're unusually sensitive to medications now, that you have side effects from doses that never bothered you before, that you feel over-medicated even on small doses, your thyroid could be impairing your liver's ability to metabolize drugs. Your thyroid affects liver function, and your liver is responsible for processing medications. When your thyroid slows down, your liver slows down, and medications build up in your system at lower doses. This is why so many older adults end up on medication lists that seem excessive for their conditions. Their thyroid and liver function is compromised, and they can't clear medications normally. Sign number 14 is something you might notice in the middle of the night or first thing in the morning. You wake up with a stiff, sore neck. You feel tightness in the front of your throat. Your neck might actually appear swollen, or you might notice visible enlargement when you look in the mirror. I want you to look at your neck right now. Tilt your head back slightly and look at the base of your neck, just above your collarbone. Do you see any visible swelling, any bulging? Does it look asymmetrical? If you press gently on your thyroid area, which is right here below your Adam's apple, do you feel any tenderness or hardness? These are all signs your thyroid is enlarged or inflamed, and this is something that requires medical evaluation. Now we have arrived at sign number 15, and this is the one I promised you at the beginning. I told you this would be important. Sign number 15 is slow ankle reflexes. This is something almost no doctor checks routinely, and it is one of the most reliable indicators of low thyroid function. When you go to the doctor for a physical, they tap your knee with a little hammer and watch your leg kick. That's a reflex test, but they almost never test your ankle reflexes. This is critical. When you tap the Achilles tendon at your ankle, the foot should bounce back react quickly. If your thyroid is underperforming, that reflex response is delayed. The foot barely moves, or it moves slowly and takes a moment to recover. This delayed ankle jerk reflex is one of the classic clinical signs of hypothyroidism, and it's something you can check on yourself right now. Ask someone to gently tap the back of your ankle right above your heel and watch how your foot responds. If it seems sluggish, if it barely moves, that is a signal you cannot ignore. All right, my friend, we've covered all 15 signs, and I want to make sure you know what to do about them now. First, do not panic. Recognizing these signs is the first step, and it's an enormously powerful one. The next thing I want you to do is get the right tests. Most doctors run a TSH test, and that is a good start, but it's not enough. Ask your doctor to run a full thyroid panel, including TSH, free T3, free T4, reverse T3, and thyroid antibodies, including TPO and thyroglobulin antibodies. These tests will give you a much more complete picture of what's happening with your thyroid. Many conventional doctors resist running the full panel, so you may need to advocate for yourself or find a functional medicine practitioner who understands the nuances of thyroid health. Second, pay attention to your nutrition. Your thyroid needs specific nutrients to function properly, and many of them are woefully absent in the standard American diet. Make sure you're getting adequate selenium, which is found in Brazil, nuts, sardines, and eggs. Get enough zinc from foods like pumpkin seeds and chickpeas. Make sure your vitamin D levels are optimal, not just in the normal range, but actually optimized. And consider working with a practitioner to ensure you're getting enough iodine, which is critical for thyroid hormone production. Third, reduce your stress. I know that sounds almost insultingly simple, but it's actually profound in its importance. Chronic stress elevates cortisol, and cortisol directly interferes with thyroid hormone conversion and function. Find stress reduction practices that work for you. Whether it's meditation, walking, deep breathing, yoga, or whatever brings you peace, make it a non-negotiable part of your daily routine. Finally, pay attention to your body. The body is an incredibly wise, sophisticated system that is always communicating with you. Those 15 signs we just walked through are not random symptoms. They are messages. And the sooner you listen to those messages, the sooner you can take action to support your thyroid and restore your health. I want you to do something right now. If you're watching this video and you recognized even 3 or 4 of these signs in yourself, I want you to take out your phone and make an appointment with your doctor this week. Not next month, this week. Request those thyroid labs. Be your own advocate. You know your body better than anyone, and if something feels wrong, trust that instinct. The body has an extraordinary capacity to heal when given the right support. I've seen it happen thousands of times in my practice over 40 years. Patients who were exhausted, gaining weight, struggling with depression and brain fog, couldn't lose weight no matter what they did, felt like something was fundamentally wrong with them. And when we identified and addressed their thyroid dysfunction, their lives changed completely. That can be your story too. If this video helped you, if it gave you insight into something you've been struggling with, please share it with someone you love, someone who might be suffering in silence, wondering why they feel so terrible all the time, being told it's just stress when it's really their thyroid. You might save someone's life today. You might give them the answer they've been searching for. And if you'd like to learn more about thyroid health and the many conditions connected to thyroid dysfunction, I've created several other videos on this channel that go even deeper. I'll put the links right here for you. Take a moment to explore them. Knowledge is power. And when it comes to your health, that power is in your hands. Remember, your body is always speaking to you. It's talking to you right now through these signs. Listen carefully, take action, and know that you have the ability to change your health story. I'm Dr. Alan Mandel, wishing you incredible health, and I'll see you in the next video. Take care of yourself, my friend. You deserve to feel great.